We have evolved from the denture milieu to the implant dentistry milieu. We are now engaged in extensive, expensive, invasive, time-intensive therapy, and yet in this day and age, we're still using outdated techniques, outdated outcome assessments to evaluate the psychological profile of our patients. So the problem is, how do we as clinicians evaluate new patients? How do we manage anger and anxiety? Now, you've already got a taste of that, because how many patients come into you and say, and I'm not talking about the single implant, I'm talking about the full mouth reconstruction. What do they tell you? I've been going to a dentist all my life. I go every 6 months, and look at the way I look. And that's what you got. So there's some anger at our profession, because dentistry failed me, and that's why my mouth is in such bad condition. And you've also dealt with the anxiety and the nervousness, but have you dealt with the hope? Because when that patient walks into your office and finally accepts you as the person to fix their mouths, they have hope. Hope that you're going to be able to actually fulfill their requirements. And can we predict how our patient's going to respond to long-term therapy, and can we do it in 15 minutes? That's all you got. How much time do you spend on the psychological management? You take a medical history, you take radiographs, you take CTs, you do all this stuff. But how much time are you spending to get to know your patient? And we're supposed to make a determination on the psychological profile in that shorter period of time. Psychologists take a minimum of 3 sessions before they make a diagnosis. They don't even like to make a diagnosis. They're forced to by insurance companies that require it. But they take 3 sessions minimum. And we're supposed to do it in, what, 15 minutes? So, you know, George Burns says, what happens? Everybody seems normal till you get to know them. And now when they're in our environments, what's happening? So for the non-prosthodontists in the audience, because only pros would be teaching something like this, okay? But all due respects to my profession and my specialty, all right? This was the house classification, which is routinely taught, or was routinely taught, in most prosthodontic programs. Now, it's based on something that was published in Jack Sharry's textbook, okay, in a chapter by Howard Payne, and the reference was notes from study club number 1. There's never been an article, there's never been anything to prove that it was valuable, and yet this is what we're teaching our residents. In fact, it was on American Board of Prosthodontics examinations. And in truth, it's ridiculous. All right? Now, where did it come from? Well, the classification of personalities is not new. It's been going on since 460 BC. Now, as my partner, Dean Vafiatis, likes to say, everything started with the Greeks, and based on what you see in 1990, looks like everything ended up with the Greeks also. But nobody is using these classifications. None. Not any of the professionals that deal with this type of patient. So another thing that we had is, I don't know, some of the gray-haired people in the audience might have had the actual luxury of seeing Alex Koper lecture on difficult denture birds. He published papers on it also. And it was a hoot, because he had all these pictures of birds dressed up in different manner, and he would be talking, you'd be laughing hysterically. But what was the point? You would look at it and you would go, you know, I got a patient just like that in my office. You put the next one up and you go, yeah, I had 2 of them in my office. So he was really correct, but not scientific. But if you look at the list of things, doesn't that look like the patients we're seeing now?